morning, class. We're going to start with a little review today to see if you can remember what we went over last time. So, as you know, the synapse was discovered by Sherrington. And do any of you remember what a synapse is? Taylor.
It is a connection between nerve fibers where one neuron ends and another begins.
Good, that's perfect. Now, if you remember, there are three different kinds. There's axoaxonic, axodendritic, and axosomatic. So, Brittany, Bailey, Taylor, and Emily, can you come up? We're going to demonstrate how these three types of synapses work really quick for everybody. All right. Emily, I'm going to have you sitting in the chair. You're going to be in the soma, so you're the body. Taylor, I want you to sit right here. Just sit with your back facing Emily and your feet out. You're an axon. And Bailey, you're going to sit the same way as Taylor. But I want you to put one of your arms out like a dendritic connection. All right, Brittany, you are the axon for a different nerve. So, if you were going to connect to Bailey, who's a dendrite, that would be considered an axodendritic connection. But if you were going to connect to Emily, who is the soma, that would be an axosomatic connection. And if you were going to connect to Taylor, who is another axon, that's going to be an axoaxonic connection. All right, does that help everybody understand? All right, you can go ahead and sit down. Yes, sir.
Can you explain again what causes a synapse to happen?
That was actually going to be my next question for the class. So can any of you explain to Brittany what causes a synapse to happen? Taylor?
The axon has a conductive segment that carries an action potential, a transmissive segment that has synaptic vessels and releases neurotransmitters, and a receptive segment which receives information. The conductive segment is stimulated, causing an increase in the resting membrane potential.
Good. And does anybody remember anything about the resting membrane potential?
Isn't it negative 70 millivolts?
Correct. And do you know why it's negative 70?
Because there's more negatively charged anions outside of the cell, and there's more sodium outside and more potassium inside.
Perfect. Along with that, when the resting membrane potential is increased, it can create an action potential. Bailey, what happens once an action potential is created?
It goes down the axon.
Good. And what causes that to happen?
The action potential causes gates to open, which lets sodium in.
Yes. And since sodium is positively charged, it causes the cytoplasm to become positively charged as well. The cell needs to be returned to the resting membrane potential, and in order for this to happen, the potassium gates of the cell have to open and allow the potassium to exit. This is called hyperpolarization. So, do you guys think that a neuron with a larger diameter or a smaller diameter is going to have a faster action potential? Emily?
Larger.
Good. And do you know if myelinated or unmyelinated are going to carry it faster?
Myelinated.
Good. And why is that?
I don't know.
Bailey?
Because myelinated neurons have something called nodes of Ringvier that allow the action potential to hop from one node to the other.
Good. And what is that process called? This Taylor.
Saltatory conduction.
Good. So once the action potential reaches the axon terminal, it causes depolarization to occur. This opens the voltage-gated sodium channels and causes an influx of sodium into the presynaptic terminal. Does anybody know what happens after this? Brittany?
It causes the vessel to move and fuse with the membrane of the terminal.
Good. And then what happens? Emily?
They release neurotransmitters into the synaptic cleft.
Good. Now Taylor, what is the synaptic cleft?
The synaptic cleft is a junction between the presynaptic and postsynaptic membrane.
Good. And does anybody know what neurotransmitters are going to do when they're released into the synaptic cleft? Bailey?
They go across the cleft and bind to the postsynaptic membrane.
Yeah. And what does that cause? Emily?
It stimulates the postsynaptic membrane and causes an action potential.
Correct. And then the whole process is going to start all over again. All right. In order to finish up our review, I have something special for us today. We're going to go into the clinic and observe some patients, and we'll see if you guys can recognize what they have just based on their symptoms. Okay? All right, class. So before we go in today, I'm going to let you know what we're going to see. We're going to see 3 patients. They're going to tell us some of their symptoms and signs, and based on that, I want you to use what you remember from class to try to figure out what their diagnosis is. So just be very respectful and remember that this is a professional setting, okay? I'm Dr. Grotto.
Hi, nice to meet you. I'm Helga.
Nice to meet you. This is one of my students.
Hi, I'm Taylor.
Nice to meet you.
Is it okay if she asks you a few questions today?
Yeah, that's okay.
So before you were diagnosed, what symptoms brought you into the doctor?
It started with dry mouth and blurred vision, and I had difficulty swallowing, but now I have muscle weakness and I have difficulty breathing as well.
Oh, difficulty breathing is known as dyspnea.
Yes. So, based on her symptoms, what do you think her diagnosis might be?
I would say based on her drooping eyelid and her other symptoms, I believe that she has botulism.
Good. So now that you know that botulism is her diagnosis, how does that affect the body?
It blocks the presynaptic ability to release ACH and therefore inhibiting the ability to produce an action potential.
Very good. Thank you so much, Helga, for letting us interview today.
You're welcome.
Hi.
Hello.
My name is Dr. Grotto. This is one of my students. Is it okay if we ask you a few questions
Yeah.
today?
It's great.
Hi, I'm Bailey. How are
Hello.
you today?
I'm good. I'm Bertha. Sorry if I give you a weird look. I don't mean to, but with my disease, I have a drooping eyelid and my facial muscles are weak, and some people get offended by it.
Oh, actually, I remember learning about that in class. Do you also have weakness of your muscles for swallowing and proximal limb movements?
I do actually. Do you know what I have?
Well, based on what I learned in class, I think you might have myasthenia gravis.
Good job. And so do you remember why this occurs?
Well, I know there's a destruction of the nicotinic receptors of the muscle cells, which means there are fewer postsynaptic receptors for acetylcholine to bind to.
Perfect. Thank you so much, Bertha, for letting us interview you today.
No problem.
Hi, my name is Dr. Grotto. I'm a physical therapist and I teach at Maryville University. Is it okay for my students ask you a few questions today?
Yeah.
Hello, I'm Brittany. What are you up to today?
I'm just working on my strength because my muscles are really weak.
So do you have any other symptoms?
Well, muscle weakness is my main symptom, but it doesn't affect just one part of my body. I have problems with holding my head up, chewing, lifting objects, climbing stairs, and I have blurry vision. So muscle weakness really affects all of my body. Oh, and I had small cell lung cancer too.
Oh. Of course, you must have Lambert-Eaton syndrome.
Good job. So, based on what we've learned about that in class, what causes Lambert-Eaton syndrome to occur?
The voltage-gated calcium channels in the presynaptic terminal are destroyed, which causes there to be a decreased release of the neurotransmitter, which causes a decrease of muscle excitation.
Perfect. Thank you so much for letting us interview you today.
No
Have
problem.
a good day.
Thank you too.
All right, let's head back to class. Today was a great review day, guys. You did awesome participating in class and in the clinic. Don't forget to study for the test next class. All right, I hope you're all ready for the test. But you're going to have to spread out. You can't sit this close together. Emily, I want you up there in that corner. Taylor, I want you in the opposite corner in the back. Bailey, I want you right here in the front. And Brittany, I want you over here in the front, please. No, Bailey, you need to scoot back around, please. Emily, can you please move to the back corner? No, over one more. You need to line up with Taylor. That's it.
Great job on the test, guys. The class average was 100%. And 4. Now I expect this every time.